If you have or suspect you may have a health problem, or if you require answers to specific healthcare questions or concerns, you should consult your physician or healthcare provider and not depend solely on information presented in this program.
Hello, I'm Dr. Steve Garner, and welcome to Ask the Doctor. It's great to be with you today. This is our 14th season, and as you know, this program was created to assist you in understanding medical issues so you can take charge of your own health. It's more important than ever to become an informed patient, and we're here to bring you timely health discussions. Now, for those who are new to the show, there are two ways to get your questions in. First, you can call the live phone line at 718-499-6101. And second, you can email us your questions at askthedoctor@netny.net, and we'll bring them into our discussion. Now, for this episode, we have Dr. Barbara Gatton, an emergency medicine attending at the New York Methodist Hospital. Next to her is Dr. Emil Bakash, the medical director for subacute rehab at CNR, and that stands for the Center for Nursing and Rehabilitation. And Dr. Gerard Lombardo, chief medical officer at United Sleep Diagnostics, Inc. Welcome. We have a great show for you today, and anybody who's a regular listener knows, we have three of our most popular guests, and we actually have the president and the vice president of the New York Methodist medical staff, which is a dangerous thing to have them both in the same spot, because if something happens to them, I don't know who's going to take over, but we'll take our chances. So before we get into meeting the doctors, let's look at in the news, and it was kind of a slow week news-wise. There was an interesting story, though, about cost awareness. They found when the residents knew what the cost of the blood test they were ordering was, that they dropped about 30%. So it's good and bad. I mean, you don't want the test being ordered to save 30 cents, but you want to have, the best thing would be to have certain protocols where doctors knew what appropriate tests, everybody agreed upon what appropriate use of the blood tests were that were being used. And again, you have a lot of ordering for defensive medicine where people don't want to get sued, so you really have to address the legal issues as well. So I don't think it's as easy as just putting the price down and getting the savings, because you don't want that. You want a systematic way to treat certain diseases, a guideline, and you want to be free of the malpractice suits that are many times just frivolous and kind of restrict the way people practice. So that was one story. Now, another story came out about Alzheimer's disease today, and it showed that memory loss, which most doctors would look for when making the diagnosis, was not present in about 40% of people at early stage. And instead, their signs included decline in the ability to carry out tasks. They had problems with behavior, vision, or language. Now, more than 200,000 Americans are affected by these symptoms and are currently not diagnosed for Alzheimer's disease. So it's important for doctors to become aware that there can be other symptoms, and in many cases, up to 30 to 40%, the symptoms are not memory loss. Now, the early treatment may help, and also planning for future events. So I think people would like to know so they can make their plans. It's important, and it's something that will be followed up on, I'm sure. Fibromyalgia, a really debilitating disease, and it was looked at how it affected people's lives. And 95%, for example, made decisions about having children based upon their condition, which is characterized as muscle tension, pain, fatigue, and sleep problems. And it's caused by the body responding to pain differently in an abnormal response. The three top concerns for people that had fibromyalgia were worrying about caring for a child, caring for the family, and managing the household. So the key thing is that it's not just a disease of pain and fatigue, but it affects the entire family and the way you live. And for many years, it was believed that it wasn't even a disease, that people were malingerers or just making this up. And it's definitely a real disease. It takes about 3 years to be diagnosed with the disease. So it's important to go to your doctor and discuss it if you're having these type symptoms. Another story talked about a fat master switch, and it found that one gene was linked to being fat, also diabetes and high cholesterol. And by developing medications to block this abnormal gene, it may be a way to treat all of these diseases, which obesity-related diseases account for about 10% of the cost of all medical treatments in the United States right now. The name of the gene was KLF14, and it's something to look out for in the future. So that's the news, and a slow week, but I think was able to find a few interesting stories in there. We have a special guest next to Monsignor Bennett. You can't see him here because we don't have the light properly. We have Sandeep Mahajan, all the way from Chicago, Illinois, who's viewing. I think he's spending time with Dr. Bakash, a medical student.
Yes, yeah, he's a medical student. He's shadowing me this month.
And he's sitting next to Monsignor Bennett. Monsignor, watch your pockets. And no, he's a shady guy, but he's all right. So I want to thank you, Monsignor, for not missing a show. And Sandeep's good to have you on board. And now we have the quiz. So everybody get the paper and pencil out. And this is a two-part quiz, and you must get both to be correct. Here's the question. In celebration of this upcoming Memorial Day holiday, part one, what is the official flower for Memorial Day? And what was Memorial Day originally called? Okay, so two parts. What's the official flower? And what was it originally called? We're going to take a short break now. When we come back, we're going to go to your questions and meet the doctors, where our topics are emergency medicine, geriatric medicine, and sleep medicine. The number to call is 718-499-6101. Now remember, you can email questions to askthedoctor@netny.net. Don't go anywhere. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
And welcome back. Welcome back to Ask the Doctor, where our topics are emergency medicine, geriatric medicine, and sleep medicine. Now let's meet our doctors. And before we do, I want to set a shout out to Dr. Stanley Chabelle, who I didn't know if you hear, I have a cold. He actually gave me a lot of medication. I don't know what I'm saying tonight, but he made me feel good. So Stanley, I want to thank you out there. I know Marie was a big fan of the show, Stanley's wife. So thanks a lot. Now we're going to get to Barbara Gatton, who par excellence emergency room physician, who, what made you go into emergency medicine?
You know, I liked having so many faces and so many patient stories and always having that challenge.
Yeah, and you do get many different faces in emergency medicine. You never know what's coming in. It's great. Now, you had a busy weekend.
Yes, this weekend was AIDS Walk New York, which I've been volunteering at for 21 years now.
Since you were 10 years old.
Or 22.
And how many people go by there? I know you give out water, right?
We had 47,000 people and raised $6.1 million.
Wow, amazing. You ever get like Kramer's where he gives the hot coffee instead of the water? You know, that was a good one. I like that. You know that episode?
You know, people would have liked it. It was rainy this Sunday.
Yeah, but that's great that you're out there. And we raised a lot of money there, right? Excellent, excellent. Thanks a lot. And we're going to look for a lot of emergency room questions. This time of year, people are out, the weekend warriors, so we'll talk about that.
It's busy.
Yeah, and Dr. Emil Bakash, who's a big favorite of the show, does a health fair at, what's the name of the church? Virgin Mary. I think we have another one coming up.
In September, there'll be another one.
Mark your calendars.
I'll give you the exact date in a later time.
Yeah, but always a full house.
Yeah, it's great. It's wonderful. Thanks for your support. It's been really
great.
nice.
So in your life, what's new?
Well, I'm actually working at a very beautiful place that does wonderful rehab called the Center for Nursing and Rehab. That's in Prospect Place in Prospect Heights in Brooklyn, near the Brooklyn Museum. It's a wonderful experience. It's the state-of-the-art rehab. I'm working there. It's very nice.
I went there. We're going to have actually, for the viewers, next week's show, tune in because we're going to have a special about the rehab place. They have virtual rehab where it's like you're playing video games and you're improving your ability to do things with nothing. There's just a blank screen, but I watched people.
It's amazing stuff.
You got to watch this.
Something from the future.
Mark it on your calendars for next week. A big show. You're going to enjoy that. Right. And as president of the medical staff, that's a big job.
Yeah, it's a big job. It's a lot of fun, though. You get to meet everybody and pull everybody
together.
So
give Dr. Lombardo's the president of waiting. Give him some advice. Let me hear what you tell him.
Right. Well, my advice is that
don't do it.
He's doing great. Yeah. No, do it. Absolutely. He'll be great.
Because if he won't do it, Emil's got to stay on for another 3 years.
He'll be great. He'll be great.
But no, you're doing a great job. You're bringing everybody together.
Thank you very
much.
It's
good camaraderie.
It's good staff. It's great to work with everybody.
Thanks a lot, and thanks for coming on.
You're welcome.
Dr. Lombardo, who's a neighbor,
Right.
and his wife is kind of a famous person, very busy. You know,
yeah, Daisy's doing well.
Yeah, great cook. Do you get good food at home, or you don't get?
Well, you know, she travels. We were talking about that.
Yeah.
She's doing her third book tour. So the first book was Daisy Cooks, and now the fourth book, not written yet, is Jerry Cooks While Daisy Travels. That's me in the kitchen.
Yeah.
So she's on the road a lot, but
what's
doing very well.
What's your favorite dish that she makes?
I'd have to say arroz con pollo, rice and chicken.
Wow.
just basic, delicious. It's one of my favorites.
And we met, and she told me Daisy said her favorite restaurant was Queen, and we met in there.
Is up there.
Yeah,
Absolutely.
On Court Street.
Yeah, Court Street. Very nice restaurant.
Good restaurant for those out there. So we met the doctors. We got a real winning group. I see we got a lot of callers. So let's see who's going to be number one. Is it going to be Maddie? Is it going to be Grace? Who could that be? Hey, who is this?
Joe Style.
Joe is amazing. He's in his 90s. He's on several boards. He's a community hospital board. And he's getting awarded, actually, this Sunday, some kind of a show, he told me. Joe?
Yeah.
Joe, what, you're getting an award this Sunday?
No. We're having a question of the order, the Holy Sepulchre, and I'm one of the. I was made commander of the church, so that we're having a lunch with the bishop and mass. Bishop DiMaggio is saying a mass.
Very nice.
And he's saying a second mass at 4 o'clock that same day.
It'll be on TV for those who want to watch, right?
Yeah, that's it, Sunday from 12:15 on.
Very good. So, Joe, what can we do for you?
Doctor, I got to tell you something. I watch these programs. You make a great image on this show.
Thanks, so it's the makeup.
What you do and the doctors that you have with you.
Thank you very much, Joe. So, Joe, what's the question?
Oh, my question. My thyroid, doc, is still swollen, and I'm on Synthroid. Right now, I'm on Synthroid, 112 mgs. Do you think that'll bring it down?
Yeah, Joe, he's got a nodule, and he's been put on medication to try and suppress it. Anybody want to talk about thyroid?
Yeah, I'd like to hear about it. It's not cancer, though.
No, he's not cancer.
No, I went to Micklewitz, and I had it done.
All right, Joe, so Dr. Backer is going to give an answer.
Sure.
Oh, great.
Yeah, if you take the thyroid medicine, it should suppress or stop the production from the thyroid nodule if that's making it by this feedback inhibition process. But yes, it will help. It certainly will prevent it from getting any. It should prevent it from getting any larger. It may not make it smaller, but it may be insignificant. About 5% of the population has thyroid nodules, so it's not that unusual at all. So I would say yes, this is a very good, appropriate treatment, and it very well may shrink it and be successful.
Thanks a lot, Joe. Thanks a lot for the call.
Thank you, doctor. God bless you.
Be well. And Jerry, we had calls last week about sleep disorder. I'm waiting to get all those calls about wearing the mask, not wearing the mask, and so on. Let's see if we're going to have one. Hi, Jerry.
Hi.
Hi. Where are you calling us from?
Bensonhurst.
Bensonhurst. Did you call last week?
Yes, I did.
Very good. What can we do for you?
I believe I have the answer to the quiz.
No, wait a second. Now step back so we can get the special effects in place. Let me just repeat the question. In celebration of upcoming Memorial Day, what is the official flower for Memorial Day, and what was Memorial Day originally called? So part number one, what was the official flower?
Poppy.
Poppy is correct. Now we're going to go to part two now. Just don't lose it here because you're very close. Okay, what was the day originally called?
Decoration Day.
Okay, I want to go to the people out there. Is that correct? Jerry, we have to applaud you. How did you get that?
I knew it right off the top of my head.
Now, do you know why it's the poppy?
I don't know.
Yeah. Well, the reason it's the poppy is when it was in some kind of a poem originally made where it reflected blood. It was red poppy, and it looked like blood of the fallen soldiers. And it actually grew better in the land where they've been fighting and dead soldiers. For whatever reason, the poppy was all that could grow. And why about Decoration Day?
Decoration? Well, I guess everybody decorated their homes.
Their graves.
And the graves with the
graves
flowers and the flags.
So now you're going to get this plaque. Only about 20 people have this plaque.
Is that right? Well, I watch you every week.
Do you have a place for this plaque?
I certainly do. I'm going to hang it right in my living room.
Excellent. It's a big crowd pleaser. They come in. They don't want to leave, though.
Well, I'll just have to kick them out.
So, Jerry, and give me a good spot out in Bensonhurst before we go on.
What would you like to know?
Where can I eat out there?
Like I said, the only place I really know is the Vegas Diner.
Yeah, and I told you died last week, the owner.
You did. And I'd like to say hello to Dr. Lombardo. He happens to be my doctor.
Great doctor.
Yes, he is. He's the one that found I had sleep apnea.
Excellent. Tell us about that sleep apnea. Jerry, what did you have? What kind of symptoms did you have?
What kind of what?
Symptoms. What were you feeling?
Oh, I was snoring. I was sleeping during the day. I was getting up during the night, like every couple of hours. And I was, having a hard time sleeping. But now I have the CPAP machine. I'm doing great.
Tell us about that, Dr. Lombardo.
Hi, Jerry. I'm glad you're doing
Dr.
well.
Lombardo.
So apnea is when the back of the throat closes as one cause, and there's a gasping, a drop in oxygen, and effects on the body that change our hormones, our response to sleep. such that sleep is not restorative. I'm sure, Jerry, you had some of these symptoms.
Yep.
And one of the treatments, and there are many, the CPAP machine is an air pressure machine that sends air in gently, as you know, opens the back of the throat and helps you get a restorative, peaceful sleep. And with that, you're able to have a good quality of life and alertness the next day. So that's the basic.
Does anybody ever
treatment.
die? I know they say the gasping for air, like they're going to die. Do people die in their sleep of this?
No, it's important. No, it's important to get that message out. I have had many, and we have Dr. Gatton here, 911 calls where a concerned spouse would see their loved one choking, call 911. The person gets to the ER, only to have Dr. Gatton check them and say, you're okay, follow up with your doctor, and there's nothing at the time they present to the emergency room. But during the choking episode, it looks very frightening. I compare it to a person choking in a restaurant on a shrimp, as in the movie that comes to mind. And it's very frightening. There's an actual grabbing of the throat. It's an asphyxiation, as it's called. And it's comparable, only you're actually choking on your own anatomy, not a piece of food. But it's that frightening, and especially to a spouse looking at someone choking and gasping, hits the 911 button, and there's the visit to the emergency room. But you do not die from sleep apnea.
Very good.
I have one question for you, Dr. Lombardo.
Yes.
Okay. I mean, there are times when I check to see what the air pressure is, and it's up to 11. What does that actually mean?
Yeah, Jerry, I don't recall what type of machine you have. The numbers reflect centimeters of water pressure. And there's a range, and some of the machines are called smart PAPs or auto PAPs.
I have the auto PAP.
Excellent. So the auto PAP actually listens to you breathe through the night. And if you need a large breath, it delivers more centimeters pressure. If you need a lighter breath, it backs off and gives less centimeter pressure. So your range may be 5 to 11. And during deep sleep, you need that 11, but during lighter sleep, it backs off to 4 centimeters. So that might explain the number that you're saying.
Jerry, thanks a lot.
Thank you.
Take care. Barbara, I saw you were going to say something. You wanted to say something? I got this music in here. Somebody, I know this classical music that kind of puts you to sleep a little bit. But it's not the show.
We really do see a lot of people in the emergency room with it, and what we recommend is a sleep study. So we send them to Dr. Lombardo and his colleagues because many, many people have this for a long time and don't realize they have it.
Yeah. Let's move on now to Marie. Hi, Marie.
Calling from Brighton Beach.
Oh, do you ever go to Tatiana's there?
Yes, I've been there once.
Isn't that a nice place?
Oh, it's very nice if you're interested in eating a lot of food.
Right, on the boardwalk, you can get a big piece of the watermelon was so sweet and a big piece of fish. How can you go wrong?
There's more than watermelon and fish.
Yeah.
There's a tremendous
But it's what you
amount
order,
of
the
food.
portion size, right?
Yeah, they give you a lot of food.
So what can we do for you tonight?
Well, this is a problem. Last week, for a month and a half, I was having arm pain. It was radiating from my shoulder down to my fingers, but I contributed to arthritis. I was treating myself. And then this past Monday, when I woke up, the pain was excruciating. I couldn't even put my arm down, so I called up my orthopedic doctor, went to his office. He said, no, I don't think this is arthritis. I think this is muscular, but let me do an x-ray. When he did, he said, I have a calcification of the tendon in my right shoulder. And he said, well, proceed with physical therapy. But the pain was so severe that I had an episode of, I syncopized. I actually fainted, then I vomited, and they rushed me to the hospital. But in any event, I just want to know one thing. He said the cause of it is wear and tear on the body, But I retired as a nurse 7 years ago. I was an ER nurse.
Yes, where were you?
I worked at Kings County and Coney Island Hospital. I had 2 jobs. So I retired at 55. So I thought from 55 to 62, I gave my body a break. But now I'm coming down with all these problems.
Let's just ask Dr. Gatton, if she walks into your emergency room, what are you going to do?
Well, I'm going to recommend the physical therapy, so I'm glad you're getting that. You can do pain management, but that isn't nearly as important as the physical therapy.
Yes.
And that you want to make sure you follow up on because there's not much more you can do. The problem is that even though you've given your body a break for a little while, it's years and years of abuse that caused it. And it is a wear and tear thing, so it's not a single injury that causes the calcifications to build up. So the fix isn't quick either, so it's not like a single pill. It's going to be ongoing physical therapy that's going to help you best.
Maria, I hope that helps you.
Can I ask you one other question?
Quick
You don't
one.
think I need surgery, do you?
No.
Just physical therapy. Okay, thank you very much.
Okay, you don't sound happy about that.
What, that I need physical therapy and
No.
I don't need surgery?
No surgery, that's good.
I've had 8 operations. I mean, a surgery is disgusting.
Right, I'm glad.
That, but if I could avoid surgery, but could I ask another question? Could
Wait,
I have
wait.
once I'm I'm physically better, could it happen again?
You can decondition after a time, and it may get back to the way it was again. Yeah, if you stop exercising, the tendon can become calcified and stiff. Stiffness is one of the things that happens with old age if you don't use it. And so you have to become active and continue the physical therapy.
This could be a good opportunity to get yourself back in shape, not just the arm, but through the whole body in exercise.
Yeah, thank you very much.
Make it a
right.
positive. All right, we try to make you happy.
Thank you.
Thanks a lot.
Bye-bye.
Bye. Let's see, Maddie's on line 4. Hi, Maddie.
Hi, doctor. How are you?
Maddie, how you feeling?
I'm feeling a little better. You know, I fell in the bathroom.
Did they bring you to the emergency room?
They called the ambulance, and I'm recuperating now.
Very good. Where'd you go?
I didn't go nowhere.
No, which hospital?
I didn't want to go to the hospital.
Oh, so you said no. Okay.
No, I didn't go.
Okay. Dr. Gatton, what do you think? Maddie's about 80 years old?
I think she should come see me.
90, no.
I was 90.
I can't keep track of this, Maddie. It's going too fast. 90, wow.
Yeah.
Well, I'm glad you're okay, and I'm glad you're recuperating. But
Yeah,
I think
thank
if
you.
you fall again, come see me.
Okay.
Let's make sure nothing serious happened, and if it's okay, we'll
Yeah.
check you out, we'll send you home and tell you it's okay.
Okay.
But you're not so young anymore, come in.
All right.
Maddie?
Thank you.
Maddie, have a good night.
Thank you, doctor.
Take care. Be well.
Okay, bye.
What we're going to do, we're going to take a short break. Excuse me. The medicine's wearing off. I have to take more. When we come back, we're going to go to your questions where the topics are emergency medicine, geriatric medicine, and sleep medicine. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
Welcome back to Ask the Doctor, and we're going to get back to your questions. But before we do, I have to mention that the NET, just like any other nonprofit organization out there, is feeling the pinch of these tough economic times. This is not a pledge drive, just me talking to you. If you enjoy our programs, such as Ask the Doctor, then please show your support. Whatever you can contribute is much appreciated, because the main thing is that we know that you care and that you support us. Also, if any businesses out there would like to sponsor the show, the official sponsor of Ask the Doctor, please contact us on the number on your screen. Thank you, and let's get back to our questions. And we have an email question that we're going to get to. It's Johnny from Whitestone. He wants to know, can taking Ambien over a long period of time cause muscle cramps and rashes on the legs? He's 63 years old and needs a sleep sedative. He's not sure if this is the cause, but he doesn't get muscle cramps in the day, only at night, a few hours after taking the Ambien. Dr. Lombardo, what about this sleep and Ambien?
Sure. You know, I think it's important, first of all, to recognize that any medication can cause numerous side effects. So it is, if you're thinking it's a side effect from your medicine, you must speak to your doctor. Now, having said that, muscle cramping at night is one of 80 sleep disorders. There's one in particular called restless leg syndrome that leads to leg movements during sleep. And those leg movements can be painful, cramping, itching, an unpleasant feeling that makes you move the legs. So you have to be careful that you're not actually experiencing one of these other sleep disorders. I'm assuming you're taking Zolpidem for insomnia. That's what it's used for, to treat insomnia. But in fact, you may have another sleep disorder that's sort of layered on top of the insomnia. So talk to your doctor about possible side effects of any drug that you're taking, and definitely talk to them about the symptom that you're having. Don't necessarily connect it to the Zolpidem.
I want to ask Dr. Backish, you deal with geriatric population. Do you shy away from Ambien?
I pretty much try to shy away from all sleeping pills in the elderly, because if you look at the habits of the elderly, they actually their total sleep time during a 24-hour period is often the same. They have fragmented sleep, and they tend to go to bed early and wake up early. So if they have poor eyesight or they're sensory deprived because of poor hearing, they don't watch TV and they don't go out. So if they go to bed when the sun goes down and say it's 8:30, 9 o'clock, and then they wake up at 4 in the morning, they've slept 7, 8 hours. So then they feel like they haven't slept enough, but in fact they really have slept enough. So I try to shy away from it because very often the pharmacokinetics and dynamics of drugs in the elderly are different. Drugs stay in the body much longer and they have many more side effects. So I try to keep away completely from sleeping pills if at all possible.
Very nice. I have one more question. Ambien, is it addicting? Do you become addicted to Ambien?
That's a very good question. I think when I consider addiction relative to sleep, I tell the story of a child who needs to be read to, and the book, the parent reads the book and it's soothing, comforting, and they become dependent night after night on that routine. So Ambien is a form of a routine. You're taking the medication. You can become dependent on the action of actually taking this pill, the way you would even a cup of warm tea. But as in terms of physiologic dependency and addiction, the way we think about some powerful drugs, it does not cause a physiologic addiction.
Very nice. Let's go to Ivan, who's been waiting patiently on line 1. Hi, Ivan. Ivan?
Hi.
Hi, Ivan. How are you doing today?
I'm still alive.
Where are you calling us from?
Midwood.
Oh, the Midwood section. Did I run into you on Avenue J?
Yeah, Avenue J.
Yeah.
How are you?
Very good. What's going on? You ever gone to Florist on Avenue J? Gus out there? Avenue J Florist?
Yeah, well, I live right across the street.
That's a great store. He's been there over 65 years.
Wow.
Gus. Big fan of the show, too, Gus.
Yes.
So what can we do for you tonight?
I have a question for Dr. Lombardo. Dr. Lombardo, my doctor is Dr. Weingarten. Are you aware of him?
Yes, I know him very well. Absolutely.
Okay. What happened is I was diagnosed with sleep apnea about a year ago. I have the CPAP machine, using it. I saw Dr. Weingarten twice, and he said I have a clean bill of health. My sleep apnea is fine. I'm using the machine. Everything is fine. What happened was I have spasms in the back of my neck, and I have vertebrae problems and arthritis. I went to physical therapy a few times, and I took epidural a few times and trigger point injections. And I'm not the biggest fan of epidurals, but I try to keep away as much as possible. What's happening is I get up every day very, very tired, fatigued. And you know what's very strange? When I bend down, like for instance, like you have to tie your shoelaces, or you have to, plug a vacuum, wrap it around the handle of the vacuum. I stand up and I get an overwhelming feeling, like very, very tired, like I want to just go to the bed and lay down just for a few minutes, because I can't do anything. I get just a very, very big tiredness. Do you have any idea if that could be from the neck?
So that's a very good question. The first thing that I would invite you to question Dr. Weingarten about, the CPAP machine is designed to give you good sleep, and in doing so, you will not be tired the next day. Now, the new technology has a compliance card in the back of the machine. So it's a small little SIM card like what goes in a phone. You'll notice it in the back of the machine. Every machine has it. And that records every hour that you're asleep with that CPAP machine. So as Dr. Weingarten reviews that information, he'll be able to tell not only is the machine on and is the air going, but if you remain on the machine. It's called compliance. And we look for 70% of nights on the machine and at least 4.5 hours averaged. And if you reach that benchmark, there's no reason why you should be tired the next day. So that's relative to the CPAP treatment. Make sure that you're using it, you're on it, and that it's helping you. Now, in terms of the neck pain sending signals, absolutely. It can be the neck pain that's waking you, unknown to you, into a lighter sleep, causing the tiredness during the day. So I invite you to discuss those two things with your doctor.
Okay, let's go to the next caller. We'll go to Rosalie. Hi, Rosalie.
Hi.
I never heard that. That's not even an oldie, but how are you doing?
Oh, I'm okay.
Where are you calling us from?
East New York.
East New York. Anything doing out there?
No, I've been in for a while. I haven't been out.
It was miserable. This whole week has been miserable.
Yeah, but I can't really walk that good no more.
Is that your question tonight?
No, I wanted to know, do they have, any of the doctors know anything about any place I could get treated for the lymphedema?
For lymphedema. And are they doing it at some of the rehab facilities? Anybody? I know of one, actually, but Dr. Bakash?
Yeah, I know there are lymphedema places throughout Brooklyn where you go there and they put the lymphedema machine on and it inflates and deflates, and it actually gives you a lot of relief and decreases the edema.
Yeah, but the only thing with that, I did that before, but my legs are at the stage now where they're too large for the machine.
Oh, they're too large for the machine. Okay. There might be a place that have bigger apparatus. We'd have to research that.
We had on the show from the Metropolitan Sports Center that's across from the New York Methodist, a lymphedema expert, and she does only lymphedema. So if you call tomorrow the number on the screen, and I'll make sure that we get you that number, because I think you could benefit. We had them on last year, actually, in one of the public service announcements.
Oh, you're talking about the 263 7th Avenue over there?
Yes. Did you go there?
No, I never. I go in that. I go over to that building because I go to the neurologist, and I go to the. I go to the neurologist and.
Well, you call them up and ask for Jill. Metro Sports, ask for Jill, and she's going to set you up. Tell me you saw it on the show.
Okay, Metro Sports.
Metro Sports, and ask for Jill.
And for Jill. I could get the number from the hospital, right?
Exactly.
Okay.
Okay, I hope you feel better.
Okay, thank you,
tough
doctor.
One. Okay, let's go to Lisa. Hi, Lisa.
Hi, how are you?
Hi, where are you calling us from?
Sheepshead Bay.
Sheepshead Bay. What? Lundy's no more, huh?
No, gone for a long time. It's Japanese restaurant and a shopping mall now.
Never thought. Do you know what the initials FWIL Lundy stood for?
You know what? I did, and I don't remember.
Did anybody here know it? If anybody here knows it, I know it's his name, Frederick Wilhelm or something. He had it was his initials. But anyway, what can we do for you?
I have actually a two-part question.
Okay.
I'm calling for my husband. The first part is he is prescribed 10 milligram Ambien by his doctor to use as needed when his insomnia becomes a problem. And we want to know, do you have to be tired for the Ambien to work? In other words, if, let's say, you're up all night and you fall asleep at 8 o'clock in the morning, and instead of staying up all night the next day, can you take it that night at 11? Do you have to be tired for the Ambien to work? Or can you just take it because you're wide awake and you want to go to sleep at a normal hour? Will it work?
So, I think the short answer to that question is the best sleep comes, and it was Leonardo da Vinci who said, a well-spent day brings happy sleep. So you really have to be active, get up in the morning. The key to treating insomnia is to rise with the sun. That's the way we're wired as human beings, to get up with the brightness, be up all day, active, socially engaged, working, sport, whatever you're doing, stay active, and then sleep comes easier. So if you nap, for example, during the day, and you're not tired, and then you look at 11 o'clock to take that pill to force sleep, it does not work.
It will not work.
It will not
for
work.
Sleep.
No,
So you really must be tired to a certain point.
Well, what you must do is, as I said, use the medicine on the advice of the doctor in sync with a routine. That is a good active day where you're tired because you've been up all day. If you take naps and use poor sleep hygiene, as it's called, bad habits and caffeine and things that are not conducive for sleep, the Ambien will not work. So you have to tie that into a sensible approach to sleep, and I agree with my colleague, Dr. Bakash. In general, we do not look to medication to treat insomnia. We look to these other behavioral changes and a more sensible approach to daytime and nighttime sleep.
Well, the other part of that is that my husband is disabled. He's on Social Security disability. He has got serious neck and back injuries, so he's definitely limited to what he could do as far as activities.
Yeah, that is a problem. So if someone, for example, is bedbound, not that your husband is bedbound from what you're describing, But the less activity you have during the day, the more the brain can register, for example, during a 20-minute nap even. The brain counts that as a form of sleep, and then it's harder to sleep at night. So as I said, it is definitely related to activity and to medical ailments that send signals to your body to wake up as you're trying to sleep, such as pain, as you mentioned in your husband. So it is a challenge, and you should talk with your doctor about his schedule is very important.
Thank you very much.
I just have one more quick part to that question.
Okay.
I just wanted to know the second part of that question. He's also prescribed Percocet 10 milligrams. Now, if he needs to take the Ambien at night and he needs the Percocet at night as well, can he take them together safely, or does he need to separate them, and if so, by how much time?
That's a good question, and certainly the safety of combination medications must be discussed with your doctor, because it's not just the number of pills you're taking, it's the health of all your organ systems, the liver, the kidneys. So you have to be careful combining medicines. I will tell you that I do have patients who have comparable combinations similar to your husband, and they do take these medications safely in combination, but again, discuss it with your doctor.
Okay, he's in good health, so if he needs to together, it's okay too?
Yes. As I said, I have patients of mine who take medications in combination. I can't speak to your husband's condition because it depends on the functioning of his body, as I mentioned before.
Thanks a lot for the question.
Thank you so much.
We appreciate it. We got Dr. Gatton, what were you going to say?
Quick tip to have him get up at the same time every day.
Okay, and I wanted to ask Dr. Backish, what about melatonin? Have you used that with any success?
Melatonin is used. It's a more of a homeopathic solution for insomnia, but there really hasn't been that much proof that it works for insomnia. A lot of studies were done on travel, on jet lag, and that's where it had, I think at one time showed some benefit, but it's not.
If anybody runs out and takes it, and either of you can, is there any danger to taking melatonin?
Not that I'm aware of. Maybe Dr. Lombardo knows of any.
For the most part, no. It is a hormone. So as such, we have to be careful with the use of any hormone. And there are certain medical conditions where you have to be careful with melatonin.
Okay, so don't just run out and take it. Speak to your doctor.
Absolutely.
Okay, we're going to Tim on line 4. Hi, Tim.
Hey, doctor, how are you?
Tim, good to hear from you. Where are you calling us from?
I'm calling you from Flatbush, Brooklyn.
Oh, very nice. Which diner? Now that the Kings Plaza diner is closed, where do you go?
Floridian.
Is that okay?
Absolutely.
I have to go in there. What do you like in there, like a signature dish?
Tuna.
Tuna sandwich?
Absolutely.
Individual can?
No.
No, I always go for the individual. I feel they can't do anything bad to it. You know, I don't like the mayonnaise. But all right, so you have it on whole wheat toast?
Yes.
Delicious. All right. What can we do for you?
I wanted to tell you that I am a New York City police officer for 18 years. I am a 9/11 survivor. Wow. And I am also a patient of Dr. Lombardo's. And he got me, I have sleep apnea, and he got me a machine right away, right after 9/11, and has worked phenomenal. And thanks to him, I am alive today. And he's a great guy. Excellent doctor to deal with for everybody who's listening. He really takes care of you, and he listens to you, and he helps you out. And my sleep apnea is doing phenomenal right now.
Tim, we have the best doctors on the show?
The best.
The best, okay.
Very kind, thank you.
Very nice to hear that. Have you seen many 9/11 survivors, either of you two?
Yes.
Any patterns that you're picking up?
It's different for different patients. Some have respiratory problems. Some have more post-traumatic stress disorder. Depends on the individuals.
I do have one question.
Sure, Tim. What's up?
After 9/11, about 2 years afterwards, they found 3 nodules on my lung. And don't get me wrong, I don't know the exact millimeters, the size it was. But how long do I have to keep going back to see if they're growing or not? Like, what's the time frame?
Okay, so he's got a couple of nodules that may be stationary. They're not changing. And he wants to know, is he going back for the rest of his life, or can he say it's now 10 years, I don't need to go back anymore?
Do you want me to?
I can start it. I mean, if it's a malignancy, generally they'll double in size every 3 months. So if there's a pattern, you know, when you're looking at something over a span of time, it's easy to see a pattern. And if it's a plateau, chances are over several years, it's unlikely. But there are tumors that can suddenly grow after remaining quiet for several years. So it depends on what it is. If it's related to asbestos exposure, those can last for several years before they turn into anything, and most of them may not turn into anything. So you need to be followed. I'd like to tell you you don't have to go anymore, but you're going to have to be followed. They're going to have to continue to follow you for several years.
I see Dr. Lombardo is shaking his head yes.
Yeah, it is very important that those exposed to the toxic dust, 911 toxic dust, enter into a program. So I hope you're part of the Mount Sinai program, for example.
Yes, I am.
Okay. So you're at the cutting edge. This is a phenomenal group. They know, for example, the risks and benefits of repeat CAT scans, which was in the news recently.
Right.
So just stick with them. You're in good hands there, and they'll help guide you through this.
Tim, thanks a lot.
And I got to come back and see you, Doc, so make an appointment for me.
All right, take care. Thanks again. We're going to take a break. I want everyone to stay on who's on the phone. We're not going to go away from you. I have to ask Dr. Gatton, though. It's the springtime. People are out there running again. You have any tips for them? Let's say, 50 years old, a little bit overweight. I'm going to get out there and start running around Prospect Park. What should they do?
First thing is see your doctor before you start an exercise program. And the second thing is go slowly. Don't think that you're going to be able to do what you could do last fall when you've taken the whole winter off. Always, whatever plan you start, go slowly, don't overdo it. And to repeat myself, as I've said before, if you're doing a walking program, you want to be able to talk but not sing. If you're going hard enough that you're panting, slow down. If you can sing, you're not really exercising. Keep on walking.
Thanks a lot. It's good to hear. And by the way, I see cameras in the emergency room. What's going on over there?
There is some filming going on. It's not disrupting any of our regular services. So if you need to come to the emergency room, come to the emergency room.
Put on a little makeup before you go there. All right, what we're going to do now, we've got a full slate of calls here, but we're going to take a short break, and when we come back, we're going to the rapid fire segment. That's the famous segment on this show. We just zip around and answer your questions, so we get through all of them. Now remember, your topics to ask are emergency medicine, geriatric medicine, and sleep medicine. We'll be right back.
Place your business on TV by becoming a sponsor to one of NET's family-friendly programs. See an increase in your revenue by reaching a potential audience of 4.3 million viewers in the tri-state area. We have a number of packages available, and we'll even produce your commercial. For information, contact us at the number on your screen and get ready to see yourself on NET.
Welcome back to Ask the Doctor, where our topics are emergency medicine, geriatric medicine, sleep medicine. Now let's get to the questions. We're going to do the rapid fire segment. These calls have been peculiar tonight. Sometimes they're all filled, sometimes they're not. So let's see how we go around. We got Indra on line one. Indra, how are you?
Hi, I'm fine, thank you.
I love the name. What does the name mean?
Goddess of Rain.
Goddess of the Rain. Beautiful. And where are you from?
I'm from Guyana.
Guyana, very nice to hear from you. So you're ready for the rapid fire part of the question?
And what is that?
We're going to answer your question in under a minute.
Okay, I'm suffering from very bad headaches.
Headaches?
And I've been to the hospital, and my blood pressure actually has never escalated. It's 177 over 99. It was ranging from 140 over 100 from Sunday, and I was told by the doctor in the ER that because of Motrin had escalated my blood pressure. I don't know how true that is.
So we have a couple of questions: the headaches, the high blood pressure, and Motrin.
Correct.
Dr. Gatton, and you can take an extra. This is complicated.
Right. The main thing to know is pain increases your blood pressure. So often, people think that their blood pressure has gone up, causing a headache, when it's really the other way around. And so taking some Tylenol, which won't raise your blood pressure, that might help your headache, will help your blood pressure often if that's why it went up. If you stub your toe, your blood pressure often goes up because you're in pain. So treat the pain and don't worry as much about your blood pressure. That being said, high blood pressure is a serious disease. You want to follow it regularly. You want to take your medicines and see your doctor.
Indra?
Yes?
Is that okay for you? Do you understand what Dr. Gatton said?
Yes, I understand. I'm just worried about it.
How old is Indra?
Indra, the
I'm
second
52.
point is that the whole class of medicines that Motrin is in, or Advil, that those can have an effect on your blood pressure. You should talk to your doctor about that as well, because you do want to treat your headaches. Okay, but don't worry as much about the headache meaning that your blood pressure is high.
Okay, Indra, how old are you?
I'm 52.
52. Okay.
Yeah.
Very good. Where are you calling us from?
Far Rockaway.
Far Rockaway. Any place out there before we let you go? We don't get many callers from there. Any good place to eat out there?
Good places like what, sir?
Like American restaurant, Italian food, or fish?
Oh, yes, a lot of it.
What's your favorite?
It's a combination.
Uh-huh.
Combination of, I love seafood.
Seafood.
Yeah.
All right, Indra, thanks for the call.
Thank you very much.
Take care. We have Frank now. Hi, Frank.
Hi.
You got a good question that Dr. Backash is going to take this one.
Okay.
So what's the question?
Okay, I have a sleeping disorder. I tried the mask, and it doesn't seem to work. I just wanted to know if there's a medication you can recommend.
Okay, so we're going to have Dr. Backash start it out, and we get a consultation, a second
sure,
opinion.
Sure. Well, one thing I would make sure that the mask fits properly, and some people are bothered by the mask or the noise the machine makes, but there's certain settings and other models of machinery I'm sure the sleep specialist could recommend. There are several medicines that could be used for sleep, but they all carry with it, you know, a risk. I mean, there's benzos, which are in the Valium family, like benzodiazepines, and they're hypnotics like Ambien, which is something we just talked about on the show. So these drugs, some of them have addicting potential, some of them have carryover effect to the next day, and they can make you feel lethargic and not clear-headed. So they're not always a great idea, especially if you're going to work. And if you take these drugs later than you would normally take them, you'll actually go to work sedated, and you know, people might actually notice that at work. So you would need to, one is, I think, go back to the sleep doctor and tell them this, and see if you can come up to some sort of resolution. And they can probably query the machine, as Dr. Lombardo had said previously, with the chip in the back to see, you know, what the problem is, if there's compliance issues with the machine and such things like that. Sure.
Excellent. Thank you.
One more.
No, I think that was well said.
Okay.
Okay, one more question?
Yeah, one of my doctors had said one of the best treatments for arthritis is swimming.
Yes, it's a great form of therapy. You can do it yourself in the Y, or you could go to an aquatherapy place where they actually have swimming pool and therapists.
Thanks. We're now going to go to Dr. Lombardo. We have an email from the Bronx, all the way from the Bronx here, and it says, "Hi, Dr. Garner. I live in the Bronx, and my mother's best friend lives in Staten Island and watches your show and insisted I write to you because I've been terribly sick for 5 years with a strange, undiagnosed symptoms." Now, here they go. Started one day when I became lightheaded and had a syncopal episode. I was taken to the hospital. I've never been sick other than stomach troubles. They said I probably had vertigo and gave me meclizine. Well, 5 years later, here I am, lightheaded, dizzy every single day. 2.5 years ago, out of nowhere, my head began to burn. She has a hot spot on her forehead the size of a golf ball. This is constant on and off. She feels like her head is going to explode. She's at wit's end. So she's got this vertigo, she's got this burning in the forehead, and she's desperate. She's had the $1 million workup. She's gone to neurologists. She's gone to dermatologists. She's gone to cardiologists, rheumatologists, acupuncture, hypnosis, nothing conclusive. She's coming here to ask the doctor.
Okay, well, certainly it's a collection of symptoms that remind me. I'll talk about a case that I had that was similar. It's a young man, and I see you're 43 years old. This young man was in his 20s, late 20s, and what he had that was similar to you was the falling down, the syncope. And he did have neurology check and the other specialists that you mentioned, checking inner ear, etc., as you pointed out. And to make the story short, he did turn out to have narcolepsy. Now, narcolepsy is a neurologic condition, and without a sleep study, you cannot diagnose narcolepsy. I don't know if added to your $1 million workup you had a sleep study, but it is possible that those episodes of falling down represent what's called cataplexy, which is a sudden loss of motor strength in your legs, and you fall down. Often it's triggered by a strong emotion, laughing, crying, and is in combination with tiredness and problems sleeping at night. So if you have anything like that, sorry to add to the $1 million workup, But I'm sharing with you I had a case that was somewhat similar, with a similar timeline for many, many years and workup.
Thank you. Thanks. I never can get this rapid fire down. And it always Eddie, how you doing?
Good, good. How are you, Doc?
Where you calling us from?
I'm calling from Rockaway Beach.
Oh, Indra just called from Rockaway.
Really?
What's the place to eat? She didn't want to commit on that. The best place to eat out there?
There's so many different places to eat. There's Tiberios for Italian food. There's steakhouses. Rockaway's noted for a lot of different types of foods.
They got that Kennedy's out there?
Kennedy's, that's another place, right?
Good place on the water there. Ever been out there?
Right.
You've got it's good spot for
Very
that
good
romantic
food.
dinner.
Very
yeah.
good food.
Okay, so what can we do for you, Ed, with
Well,
rapid fire?
Here's the thing, Doc. My granddaughter is 5, going to be 6 years old, and the problem with her is she wets her. She's still in pull-ups. We tried the underwear, but that's not working. And she wakes up in the morning with about 2 pounds of urine in the pull-up. And it's becoming a problem because she doesn't get up in the middle of the night. I don't know if she feels the urine coming out.
How old is
or
she?
If it's behavior. She's going to be 6 in August.
Okay, I'm going to give this to Dr. Gatton. Dr. Gatton, you're next.
Okay, thank you.
You're welcome.
This is often caused by a number of different problems, and you need to work carefully with her pediatrician.
Okay.
And part of it is not to put too much pressure on her. Some of it is teaching habits, making sure she goes to the bathroom before she goes to bed. And then, you'll need to work carefully with her pediatrician because there's a lot of different things that can cause it, and there's not a one fix, and it usually takes a little time, and certainly a lot of patience.
A lot of patience.
But part of it is don't put too much pressure on her.
Not to put too
Thanks a lot. She doesn't have diabetes or anything like that, does she?
No, she's not that we know of. No, she
Great.
doesn't have diabetes.
Beautiful. Thanks a lot.
Okay, thanks, Doc. Appreciate it.
Thanks for the call. Let's go to Elaine now, waiting patiently. Hi, Elaine.
Hi.
How are you?
I'm okay.
Hi, where are you calling us from?
I'm calling from Brooklyn, New York.
What part?
Midwood.
Midwood area. Very nice. Where do you like to eat there?
Where do I like to eat?
Yeah.
Well, at Frank's Pizzeria on Flatbush Avenue.
That is a nice place.
You know it?
Very nice. Yeah, I go there occasionally.
Who is this?
Yeah, maybe we'll run into each other.
Okay.
What can we do for you? We got
Well-
Dr. Backish on deck here for this.
Okay, well, about a month ago, my husband went for a general checkup to our family doctor, and I received a call that he passed out, was very ill, and doctor called an ambulance and took him to Maimonides Hospital, where he spent 3 days. And they say he didn't have a heart attack, he didn't have a stroke, he had something called vasovagal. Did you ever hear of that?
Dr. Backish, vasovagal.
Yeah, vasovagal syncope or vasovagal fainting, it refers to the vagus nerve when the vagus nerve is stimulated, which is one of the cranial nerves, and it causes a sudden relaxing of the blood vessels, so the blood pressure drops suddenly. And it can happen by when someone's in pain, or sometimes if you draw someone's blood, they'll suddenly, their blood pressures will drop, or if they shave.
Well, that's what happened. They were drawing blood and they couldn't.
So that can happen a lot if you stick a needle. It's not the pain of the needle. There's a reflex in some patients where you stick a needle in their arm and it'll just pass out. So next time he has his blood drawn, he's got to lay down flat.
Well, we're going tomorrow because they want to check, because they sent him home from the hospital with 5 different medications, and he doesn't want to take them.
Well, he's got to lie down flat when they draw his blood, and then they'll know what to do as far as the medications go. But the less medicine, the better.
Thanks,
in most
Elaine.
cases.
Thanks a lot. I'm sorry we got to miss. We got our last caller is Anna today. Hi, Anna.
Hi.
Where are you calling us from?
Hell's Kitchen.
Hell's Kitchen. Good. First call from Manhattan tonight. You like Pietrasino? What's that name? Pietrasanto. Nice.
I'm originally from Bay Ridge, Brooklyn.
Oh, so what do you like out there?
Hell's Kitchen?
Hell's Kitchen or Bay Ridge for food?
I like Bay Ridge.
Me too. Good choice. Good choice. What can we do for you?
Yes. I'm a psychiatric patient. I'm on Remron, 45 milligrams, trazodone 150, and Neurontin 600. I take it about 10:30 every night, all my meds, and every morning when I get up, I'm very dizzy all the time.
Dr. Lombardo's going to take this one.
Yeah, so again, the amount of time you're asleep does not necessarily guarantee that you're going to wake up refreshed the way you should. So there might be something wrong with your sleep. For example, if you've been told you snore, or someone notes pauses in your breathing. Sleep apnea, and we've spoken about it tonight, will definitely cause you to feel unrefreshed in the morning. So I'd advise you to talk to your doctor, let them take a look in the back of your throat, and screen you with a history for sleep apnea syndrome.
Thanks so much for your questions. I've got people on the line, but I hate to do it. But we'll come back next week, so get your fingers ready to start dialing for next week's episode. And that's it for this one. I want to thank Dr. Barbara Gatton, Dr. Emil Bakash, and Dr. Gerard Lombardo for coming in. And I hope we're able to help you. Now remember, it's good to always be proactive about your health. Speak to your doctors about your concerns. Go for second or third opinions like we talked about tonight. In the meantime, visit our website at netny.net, ask the doctor, for my video blogs, the tablet column, podcast forum, and many more. I want to thank Dr. Linda Lapatosa, our quizmaster, and thank you for all your questions. Next week, we're going to talk about lung disease, laparoscopic surgery, and internal medicine. And remember, tonight at 10 o'clock on this very same station, you can see a repeat of last week's show if you didn't get enough. So 10 o'clock tonight on the net. So until next week, goodbye, stay well, and I'll see you in the tablet.